And I want to introduce to the show Staci Keller, because it was a patient of yours. And, like you said, not everybody's going to be experiencing health problems, but Staci, welcome to the show, and thank you for sharing your story, because you were having health problems that you figured probably might be coming from your fillings, right?
I was, yes. I had brain fog, I had dizziness, severe vertigo, and it slowly came on. It just gradually kind of came on, and we went and we had about every test done, blood test, MRI, everything came back fine, and we were just stupefied. Didn't know what to do. And then one of my husband's patients came in and said that his wife had the same symptom, and it was from mercury. So then we got on the internet and looked for a smart dentist, and we came upon Dr. Maria, and it's just been a lifesaver for me and for my family.
You're from Mobridge, right? So you drove in to see Dr. Dwyer, and was it the difference between night and day once they were gone?
No, I had a lot of cavities in my mouth. So she did a section, 4 sections separately. So I went up 4 times, and it was a gradual process. But the more I got out, the more my brain lifted, and I didn't have vertigo anymore, and I could drive. I mean, I couldn't even drive for a while. It was bad. Yeah.
When I first saw Staci, I'll never forget the day that you came to my office that first time for our first consult. Your husband, which we love, by the way, he's so sweet, walked you down the hall because you couldn't walk. Well, you couldn't walk on your own.
No.
And so he accompanied you down the hall, and you were hanging onto his arm, and you sat down, and it was all you could do to even really make it through our session together.
Yeah.
And it was pretty severe. And then when you came back for your follow-up visit after we had removed all your silver fillings, you were like a completely different person.
Oh, yeah.
It's one of those things where, like, if you didn't see it with your own eyes, it was like too hard. Wouldn't believe it. It was one of those transformations. And because I had several interactions with Staci and her husband, it was just incredible.
So
the night and day, you got this sparkle back in your eyes, and you're like, I can go on the floor and play with my grandkids again. And
when you get that mercury pulled out, take it out, how long is it still?
It's still in your cells. Yep, it's still in your cells. Like I talked. I mean, I could spend a whole hour talking about just this, biochemistry of mercury itself, and how just a sneaky little toxin it is, and why it's so harmful, and what it does in the bodies. But like we talked about earlier before the show started, it stays in your cell for a very, very, very long time. That's because it's oxidized. Once it's in your cell, it gains a charge, so it can't easily, pass through. It needs active transporters to bind to the mercury and carry it out of the cell membrane. Well, mercury destroys the enzymes that actually facilitate that exit out of the cell. So it stays in your cell. You have to be pretty intentional about removing the mercury that's hidden in your tissue and in your fat cells. And that's a chelation process that you can visit with any functional medicine doctor, or there's a few people in town that can help you do some chelation and get rid of your mercury in your body, because it just won't come out on its own.